friends. I'm Keens. I come from India. Before surgery, my height was 165 centimeters. I desired to get 5 to 6 centimeters taller. So after surgery, my height came out to be 171 around. I did a lot of research before entering into this ordeal. I looked into various websites, researched a lot of doctors, and understood the procedure, the complications, and met a lot of practitioners, orthopedics, physiotherapists before actually deciding to go for it. It actually took me a lot of time. I was very conservative at the start, so I did not readily get into this deal. I took some time for research, and after research I did a lot of overthinking of whether I should do it or not. The entire time that I took was somewhere around 1.5 to 2 years before I decided to step into this deal. Well, on the surgery day, I got a little nervous, actually a lot nervous, and I was afraid. I got anxious and was panicking a lot because finally it was the day when I had to go through the procedure and deal with it. But my team was really cooperative. The doctor was very accommodating in answering to all my queries. Harry was the real man behind the journey. He once again was a big support during the entire thing. He comforted me a lot, and he was there with me till the last time. And I actually thought on the day, actually right on the day of the surgery, when he took me to the hospital, took me to my room, and showed me the bed and other things, I actually thought of backing out and even discussed the same with Harry. But again, he was really he really comforted me and boosted my confidence and reminded me of all the struggles that I took before reaching to the point. So yeah, it was great. I was anxious. So overall I was anxious. I would lie if I say I wouldn't, but yeah, I think it's quite obvious for anyone to get anxious at the day of the surgery. I think it's very normal. It's normal, not just for LL, but for any surgery, I guess, as a matter of fact. So it was normal. So I really got anxious. So I stayed at the hospital for about 5 days, after which I was moved to my hotel room, where I took 1 week of bed rest, after which I started my lengthening. So initially for 2-3 centimeters, I lengthened a millimeter a day, and then after that I reduced my lengthening to 0.75 just to keep up with my soft tissues. I think in LL lengthening phase is when the real journey begins, and so every day I used to get my physiotherapy sessions 2 times a day. Harry did an excellent job at physio. He knows I mean literally everything about your tendons, muscles, and how you can do all the exercises. All of his exercises and his recommendations really came handy. Every week a doctor paid a visit, and so everything was under control and was monitored very closely by my team. They were very responsive to any condition that I had. Pain overall was, I don't think really that pain was something which bothered me a lot. It was actually the discomfort. During the lengthening phase, I barely had a good night's sleep. Every night I remember I used to get up every 2 hours, and I couldn't take turns at night, and every time I used to turn my legs, the pin sites were irritating me a lot, and the frames, there was a time when frames got bulkier, and so the real challenge was sleeping, the discomfort. As for the pain, I don't think I really had to take any painkillers. So well, honestly, I think my PT sessions are going really well. I am 4 months post my initial surgery and almost a month. It's been a month since my frame removal surgery, and I can see myself already walking short distances. So I am impressed by the physiotherapy that I have gone through. I think my team has done a really good job at my legs, bringing them back to normal. As much as I would like to run and jog, but I was told that these things are going to take time. It takes 1 month for every centimeter you grow. So I am hoping for another 2 months before I could start light jogging, and steadily I'll go up, increase my level to the point where I'll start running. But I'll do update and post a video for the same, and I'm all excited for the next phase. Well, I chose Dr. Sharma and Harry. Again, the choice was based on a lengthy research. Apart from online, I did a lot of field work, went to a lot of hospitals, talked to a lot of doctors about the LL, but their approach was really impressive to me, and it is why I chose them. Dr. Sharma and Harry were very patient in answering to all my queries, and even the ones that I forgot to ask them, they were very open about the process. They just took me through each and every detail of the procedure. Although I had come, I did my homework of getting to know the procedure, but they were there to even tell me things which I had missed in my own research, and they just wanted everything to be clear from both the sides. They understood my mind, helped me really know, talked me through my decision, and their approach was very conservative, and they were really accommodating. So their attitude was the biggest reason why I decided to go ahead, why I chose them over the other doctors. So different from other doctors, they were like a team, and they really made me know all the points. So that was the key. Was it worth it? Sure it was. Any day. Now, having achieved my target, standing at a new height, sure, I can tell it was worth it. I'm all set and waiting to move out in the real world and meet other people and see what they have to say about my new height. I think it was worth it. LL is a complicated surgery, and it is very important for the patients to understand the procedure, do your research, make a list of questions. I mean, whosoever your doctor is, completely bother his mind, bother him with all the questions. Do not care if they get irritated or not. Just be completely clear in your mind that you want to do this. And the best way to be sure about this is to do your research. Research is the key here. And I chose Dr. Harry and Dr. Sharma because of my research. I did the research, I talked to doctors, and that is why I chose them. So research is the key. Any doctor you choose, research will be your biggest strength, because once again the nature of surgery is not typical. So research is the key. It is the best way to avoid any complications. Do your comparisons, talk to doctors. That is the only way you can arrive at the best results.